He let a grown man land on his ankle, and that should have ended him. And this was already injury number 20-something. By the end of this video, you will know the exact systems that we use in our clinic in Heartland Rehab to go through 30 plus injuries and look at the exact frameworks that got him to make a comeback. So my name is Bala, I'm the sports physio, and I run Heartland Rehab. And today we have with me national rugby player Ezekiel, who I've treated for more than 6 years through multiple injuries. And if you want to know about all these injuries and how he made a comeback, be it ankle, shoulders, fractures, fingers, thumbs, everything under the sun, stay tuned to the end and you will learn hopefully something. All right, man.
Oh, there is a lot. What an introduction. I never thought I'd be introduced that way, but really is. I think it's been 8 years since I first saw you even.
Oh, it's about 8 years.
Yeah. I fondly remember the first time I met you actually. It was before training, and I went up to you and I said, "Hey, Bala." Oh, okay. I didn't even know your name then. I was like, "Hey, physio."
Physio, yes.
Hey, physio. My right ankle a bit pain. Can you tape me up? And then the first thing you said was, "There's nothing much I can do now, besides trying to tape you up and then fix you up before training." But really no help. It is like last course effort already.
Because you just had a sprain.
It was a minor sprain. But it's my first sprain, you see.
Yeah.
So I think that's why I learned that every first injury is damn painful. Yeah, and I think that it was literally since then it opened the floodgates to all the injuries lah. Yeah.
I still remember that. So it was in Saints Field.
Yeah.
Saints Field, right? Yeah. So I was covering training. Then you came up and you said, "Oh, I just sprained my ankle. Can you like fix me up so I can play?" Then I said, "Oh, can you sit down? Let me have a look." Then true enough, there was a sprain. I said, "If you really want to play, I can tape you up, but go and get it checked. Go and get it treated." But of course back then I don't think we had like a pathway to look after you to make sure that you went ahead to see someone, got some rehab done. I think it was very touch and go.
Yeah,
at that point in time. Then fast forward, then other things happened to your ankle.
So I think why I say that there's a floodgate, because I think one is I did not take injury management properly. So pathway is one of them, but I think I was not interested in taking care of my injury. I was young. I just wanted to get on a field and play.
Yes.
Right. It was literally tape me up. If it's scotch tape, that's enough. Just get me on a field. So I did not have any injury management, and lo and behold, the year after, that's where I broke my ankle. And I remember just dropping you a text like, "Hey bro, I broke it." And then I was at I did a complete surgery for it. I think the biggest thing that I learned from that was actually just my own management of my injuries lah. I mean, it took probably close to a decade of me learning that lah.
Yeah. So you broke your ankle. So maybe you can, if you don't mind, share with us like how did it happen? How can you break your ankle?
Okay. Let me see. So one, the ground was uneven. The field, the pitch I was playing on was uneven. And I think what happened, if I remember, okay, I do remember it. It's quite freaky. So I was chasing back a kick, and the guy that I was chasing he kind of pivoted and turned a different direction, away from me or back to where I came from.
Yeah.
So my foot got caught in the ground while I was holding on to him, and my whole body twisted. So my whole body twisted, my foot got caught in the ground, and essentially foot stayed, the whole body turned. Then that's where I fractured the malleolus on the outside. Fractured
the fibula.
So it twisted,
malleolus,
fractured. I don't know what it was called, but at the point in time I heard a pop, 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 3 big pops. And then I saw the tips of my toe touching the side of my shin. And then that's when I knew I screwed it up. Yeah.
Tips of your toes touching the side of your shin.
Yeah.
So it was like up and
So if this was my shin, this is my calves, right?
Yeah.
It was like twisted like that, 90 degree. And then it broke on the bone outside, and then the toes were touching the
so
side.
you kind of jammed your whole foot
all the way.
Oh my goodness.
And then it was quite freaky because the onsite physio came in. I was in panic, felt the pain. And then I think in panic, right, when I saw it, firstly I didn't shout. I was like, my foot one side already. So I don't know why I did it, but I swung my foot back. So I felt the grinding back again. And then it kind of got into place.
Beep. Like not safe for kids, man.
So the physio came in, and then because he swung back in place, but the swelling started already, I think he assessed that it's a very bad sprain. Right. But I couldn't bear weight proper then. That's what happened, and I went to the hospital, did X-ray, and that's where I realized, like, boy, you complete fracture. You see this line? You see this black line? It's broken. And like,
it's not joined together.
yeah, it really shattered me like at that point in time, to be very honest, because I think I was quite excited to pursue or exploring the idea of a professional career in rugby also.
And at that point, were you playing for club, school team, nationals? What were you doing at that?
So at that point, I was playing club and national level, still very young age. I think I was 18. Let me do quick math. I think I was 18 or 19 years old then.
Yeah.
So boy with aspirations.
NS.
Just before NS actually.
Just before NS, wow.
I still had hair. Yeah. And then that's why I broke my ankle. I think I was shattered, and I think in that moment, all I needed to do was, I mean, definitely I started spiraling in my head, but one thing I knew that, so, okay, touch my heart. This is what happened. I just remembered that first interaction with you. Okay, not even you, a health provider just said, go and seek treatment lah. You cannot play when you are not fit. You just get injured. So I think at the point of crisis, I just recalled that phrase. I don't know who said it, but I thought of it, and I think what got me through the hospitalization period was, okay, if the doctors are fixing me, they're gonna get me through lah, and I'm gonna be fit lah.
Yeah. They make it better, fix you up, and you will be back on the field. It will give you some hope at that point in time. Okay, so you did your surgery in the hospital.
Yep.
They put in some plates, screws.
Yeah.
And what did you do after that? Were you able to do
so
some rehab? What did you do?
What was surprising was immediately after I did 3 surgeries over 10 days. Yeah, it's quite freaky. But I liked it though. I like being under the gas. Yeah, but I think I fondly remember the surgeon actually visiting me in my room, and he said, once you are out, once you're discharged, start bearing weight to speed up bone growth, right? So essentially that's the first thing I did.
Yeah.
Bone growth, I just kept putting weight on. Started drinking a lot of milk for calcium. And then I think on the subsequent visit and all, they were saying like your timeline to getting back to straight line running, probably 6 months. I think if you recall, that was when I started consulting you also. Like it's very stiff. My feet is stiff. I want to get it moving soon.
Yes.
I think that's where I basically gave you a bam, fresh out of surgery, still got bruising, ugly bruising. And I think that's where I got into a bit of friction point, because 1, I want to get on my feet quickly. But 2, there's a period of rest that you've always encouraged. It was, we have to get you strong, but at the same time, you need to stretch out the scar tissues and all that. So I was very confused at that point in time. But I just remember, just follow what the health provider says.
Yeah.
So if the doctor say bear weight for bone growth, do it. If my physio says stretch and do light walking and just do like, I think it's like a knee to wall kind of activity, just kind of stretch it out. That's all I did. So I think I went through that, but mentally it wasn't in the
go too far back.
Best shape lah. Yeah. Oops, sorry. yeah. So that's what I did. And then a big part of it was actually you didn't ask me to rush into it, because I think I was panicking and I knew I wanted to come back soon. The last thing I wanted to hear was someone to slow down, for someone to tell me to slow down actually, but you did that, and I don't know why. That actually helped, because I cannot rush recovery. I only can just do it with discipline instead. Yeah.
I think it was definitely quite a process you went through. So of course, at the start, some form of immobilization, even doctor, I mean, especially you've done a surgery.
Yeah.
So you need even the plates and screws that they put to fuse it back into your bone to be one again.
Yeah.
So you need a time of rest. Then after that, like you said, we do need to gradually encourage back the range of motion, the movement. So exactly that's what we did. And do you feel like you made a full recovery at that point in time?
I think it honestly, okay, you saw me for it. I've seen my specialist for it, and I saw my own recovery. I think I made a full recovery by definition of anatomy, right? Or like physically, I was healed maybe 1.5 years.
Yeah.
But it took me 3 years to mentally heal from it.
For sure.
Honestly, I think if you recall, there were times where there was minor sprains, or it wasn't even sprains, just minor pains. you will receive a ping from me like, hey, something's up, man. But actually, it's nothing severe.
Yeah.
And then I think it really took me 2 years, maybe 2.5 years to break that mental barrier, to believe that I was actually healed. So it was 1.5 years for me to be fully recovered, but to be getting back on, because it was straight line running then also. To get into rugby, I have to be bearing load, like not just my weight, but if I tackle someone, I have to bear that load as well, or the force impact that comes into me. That's one. And then the other is also the cutting as you run and pivoting. And that was basically the crux of the issue. How I broke my ankle was the pivoting. So I think that was really scary for me.
Yes.
I could not get over it on like the mental state of going past cutting due to trauma, but I think it really got easier with rehab, with strengthening lah. Because that gives me confidence. I remember one thing that you said was, easy, there's nothing else really. You're actually fit to go. Then that's where I realized that it's all me, it's all mental already.
Yeah, man. Yeah. Even I mean specifically for knees and ACLs and all that. Half more times than not, why people don't go back to sport, it's not so much like the physical symptoms or the functional recovery, but it's in the mind. You know, you don't feel ready. You tend to portray the worst case scenarios. You know, what if this happens? Don't feel confident and so on.
Yeah.
So even for like for the foot and ankle, right? So there are tools out there, you know, such as like the foot and ankle ability measure (FAAM), and even like the CAIT. These are all like tools that you can a questionnaire that you can find online. You can even fill that up, and basically it gives you an idea of how confident you feel about specifically this for the ankle, and there are others for like shoulders and knees and so on, which is sometimes good to self-assess and bring it to your healthcare provider or your physio, so that you know you can say actually this part of the questionnaire where they ask me how confident to what extent do you think you are going to re-injure yourself? Then you say, oh, wow, I rate it as like a 8 out of 10, right? Then there's something that now the healthcare provider can talk to you more from almost like a mental therapy kind of view. For me, then what I would do is literally show you, let's try run, let's try jump, let's try get into a bit of a simulated contact. How do you feel? Actually, then you're like, I can do it. Then that maybe brings down the scoring to maybe a 4 now. Then we work on it. How about you go and expose yourself to training? Don't go full contact. Tell your coach that you are practicing. And get on the field, you know, because there are people out there who don't go through the process. They think it's from the physio bed to playing full contact. So there's all these like things in between, which is going to give you that confidence, which I'm sure you might have done part of it in that period where you're trying to build up the confidence again.
I mean, now that you mention it, I didn't know that you were going through that with me. Because I think there were definitely occasions when you say I would bring forward my queries like I'm not ready yet, but I didn't know that you were doing that check on me, because it was always the evidence that you show me, like, easy, you can do it, like, let's try. Right? And then I do it, and then you say, you actually are ready, and then that evidence increases my confidence. And from there, I get my own mental clearance, like, hey, I can go forward with it already.
Correct. So some people, there's even a high chance of injuring your opposite side if you don't make a full recovery, especially for ACLs and knees. That's because, you know, you're afraid to load, afraid to put weight.
True.
You didn't go through a trial period, then you overdo it on the opposite side, right? So very important. So, I mean, amazing. And of course, kudos to your own mental perseverance and so on to make it out of that, Not easy, but you are a national athlete.
Yes. Should have broken me, It really should have broken me.
And then after that,
there's after that. I forgot I have a laundry list of injuries to go through.
Then let's talk about your shoulder. Okay, so let me read to you, if you can recall, 29 July 2020, you felt a click in the left shoulder during your incline bench press, and 3 days prior, finished the rep, then pain started, then you felt a lot of weakness into external rotation. So that was July 2020. So that was 6 years ago. Exactly. Well, what was going through your mind at that point in time?
Okay.
When your left shoulder entered the picture.
Honestly, it was another again moment. Because I think at that point in time I wasn't fit, but there wasn't a injury prior to that, to my left shoulder. I literally was doing my incline bench press. I think if I'm not wrong, because it was 2020, it was COVID, I was just trying to gear myself up in preparation for if there's any rugby to resume in 2021 or soon. So that was my preparation period. And considering that was just after my ankle fracture and surgery, it was a again moment. And I knew I just had to come back and check. Okay, so one thing that I learned from that or from my ankle injury was just quick response. The faster I get it seen, the quicker it is for me to rule out any possible injuries. And that gives me mental clarity also. So I don't think like, oh shit, maybe it's until my rib cage that's also injured. But just get it ruled out first.
Yeah.
And then I realized that we can then assess the actual issue, the root cause. So I can't recall what happened then, but I don't know whether it was just too heavy of a load or I just did not retract my scapula, but I think it just went down too deep. And then when I was pushing back up, I felt a click. I think, yeah, as I'm doing it out, I'm actually feeling again. Big trauma. Yeah. But really, when I say again, I immediately thought, I need to go surgery again. Yeah, so that was the first thing I went through my mind. I knew I had to come. I went to you only to really rule out injuries. And then if we can find a root cause, let's treat it quickly, as soon as possible. So like not to delay it.
Yeah, for sure, man. So yeah, a lot of my clients these days are in that same mindset whereby they often come in just to get it checked because they don't want to be in a situation where they were maybe in their past injuries where they left it too late.
Yeah.
They didn't have clarity, didn't have confidence, then they go back to sport with that mental load. So you came in, got it checked, and I told you, these are the things to work on. I think pretty much I didn't see you for that after, so I assume it was quite well. And then moving forward from there, I think between the year of 2021 to 2022, I think then your left ankle acted out again. So a couple of incidences, was touch rugby, badminton. I think you re-sprained your ankle.
Yeah.
And this was your left side.
Yeah.
What was happening during this period? So 2021, 2022, it was still during COVID, post-COVID. Yeah.
So I guess at that point it was okay. My right ankle feels okay. I guess I'm ready to explore other cutting kind of activities. So badminton and touch, like you said. Then I got a bit overzealous, or maybe just excited. That I probably this is a term that I learned from you. Compensation injury, where just the opposite side started to overload instead, and then that's where it got injured. And I think at that point in time, so my ankle wasn't my right ankle, the one that went through an operation. I think structurally it was stable, but the soft tissues probably weren't.
Yeah. Like
the bones were healed.
Yeah.
Everything else in the big picture looks okay, but probably like the minor tweaks and all, I was actually just loading more on my left. So at that point in time, it wasn't a again moment. It was the seriously moment, because having one ankle done is a big issue altogether. But now having both sides, bro, being on my feet is my bread and butter.
Yeah.
So if I can't,
and you only have 2 feet, you maxed out.
So okay, it was at a point it became a running joke, like, easy, you're bionic already lah, bro. Like, go and order another ankle from Taobao or something, like get it fixed. But at a point in time, that's why I really took the injury a lot more seriously. I think for me to even come to you for badminton injury, it must have been minor.
Yeah.
But like I said, right, the quick response to just get it checked.
Yeah.
To even get a treatment plan for it, no matter how small or how big the issue is. I think just relying on the help and resources I had really helped me get through. Because I think that as much as I have a long laundry list of injuries, because I saw you at least, or get it checked quickly, their timeline from injury to recovery was actually shortened by a lot.
Correct, yeah. So if you look at the notes, they all like bouts of period, and you come in, get it checked, this is what you need to do.
Done. Get
out. Out of here. And it seems like at that point in time, badminton was something you were quite
in thing, bro. Before I went to play rugby, I wanted to be a badminton player. I actually
Correct.
did. My dad was like, hey, you need to try rugby. Like, I hated rugby. But now I'm in love with the game. But yeah, so coming back to the injury, I guess that was something that I did but it took a painful lesson through a broken ankle for me to understand that when you have a symptom, when you have an injury, think if I'm using the Singaporean term correct, don't be smaku lah. Right? Don't act smart.
Yeah.
Right? Try to run it out. Try to live with it. I think it was at a point that I learned any small symptom is worthwhile checking. Like, you know how they say, like, there's no stupid question? Yeah, so same principle.
Yeah.
Like, there's no too small of an injury to get it checked.
Yeah.
Yeah.
And after which, let's talk about. So I think after that you went back to contact rugby.
Yeah.
Right, and that's where we started having contusions to the rib, if you recall. Okay, I think usually rib contusions are not fun because it's gonna affect your day to day.
Yeah.
Do you remember that? So it was like a sevens game. You got tackled on the right side.
Yeah, I remember that only because I'm a funny man. I enjoy laughing. Humor is important to me. So when you have a rib contusion, you cannot laugh.
Yeah.
Bro, I was holding my breath, bro. So I remember that very clearly because it's like, I'm easily tickled. So any small thing can tickle me. Actually, I tickle myself more than people make fun. Right? I'm also laughing at my own jokes. So when I felt back to the injury, right? When I got it, I honestly thought I cracked the rib. I did not hear a pop, but it was just so painful. I can't even lift my elbow over my shoulder.
Yeah.
Because it kind of stretched something in the area. I couldn't breathe. I couldn't sneeze. I couldn't cough. I couldn't sleep. So I had the worst sleep ever at a point of time. I think it became a force of habit already. Once I get something, I text you first, right? And I remember something. I thought that it was, I think at the point of panic, it was I should go straight to a specialist, a bone specialist of some sort. I think when I dropped you a text, I remember you saying, just get an X-ray scan first, rule out a fracture, and then we can see. I think you didn't say to see you, but you said then only I can kind of understand how to advise you what's next, what's the next pathway.
Yeah.
So I went to X-ray, scan was clear, and that's when I saw you did your checks, and then if I recall, and if there's such a thing, I think it was a bone bruise, and there was nothing I could do about it except rest and wait it out.
Yeah. Which is the hardest part.
Yeah. So I laughing is a privilege now.
Yes.
Yeah. So that was actually the injury. That was one of the more painful moments because coming back to the other injuries you mentioned, shoulder, ankle, those were slow, but they were active recovery, active rehab.
Yeah.
This is damn passive.
Yes.
And then like how long until I can sleep properly? I don't even know.
Yes.
I just need to wait it out.
So these are one of those annoying ones. So they are definitely for this kind of your rib contusions.
Yeah.
and you're not the first. A lot of rugby players they get tackled. They are in quite sharp pain, and those who know me then often they will text me say, hey, can I come and see you?
Yeah.
So then usually my first advice is go and get an X-ray minimum. Then we can rule out the most major thing that can happen there, which is a broken bone, right? If it's not, we can have a look, but chances are it's going to be something associated with the bone, muscles connecting to your ribs, and very often you just need plenty of rest, give it time, and splint it. So just using a pillow to support, all that should get you through it, rather than coming in for physio sessions.
But I think I just want to bring it up now that I recall it. I think what was not just one is painful. Two is just you can have your X-ray scan, but I was being super paranoid because it was like the evidence does not tally with how I feel or what I'm experiencing. It says there's no
nothing
fracture,
broken, yes,
but I can't breathe. And I think that's why I started thinking like, is there internal bleeding into my lungs? Did something puncture instead? I think one thing that most healthcare providers I realize, I've seen a few, they don't do very well is actually just to bring composure in a state of panic, right? It's not just, it's nothing, I don't think much about it, but it's really, it is giving the evidence and then not even coaxing you, but even telling you or telling me how to properly treat it and not get out of my head. And if anything, they really preempt me. It's like, easy, you'll feel this pain. In the next 2 weeks, you will feel this pain, but it is not out of trend, normal one.
Yeah.
So that is something that I realized, or at least a skill that I think not every healthcare provider has, or they have it, but they do it very well.
Correct.
Yeah.
So it's more of there are different kinds of pain, and often people panic or get anxious with
Mm-hmm.
pain is when the pain is unexpected,
Yeah.
right? So you go to the gym, you saw it's also pain, right? But you
Mm-hmm.
expect it, so you're not very concerned.
Yeah.
Whereas out of the blue, you're sleeping all day, then you have pain.
Yeah.
You're like, oh, okay, I need to go and see someone for it, right?
Yeah.
So
Yeah.
yeah, for sure, man. I think it's a skill that healthcare professionals should have
Yeah.
to educate people on what to expect next.
Mm-hmm.
Even after surgery, right? If someone tells you for the next 4 weeks you're gonna have night pain because
Yeah.
the bone's healing, then you're like, when you have the pain, you don't call the doctor again and say, "Can I want to come in?" Right? Yeah, very true, man. I think yeah, very important thing that people okay. Personally, maybe I do it. I don't even realize that that
No, I'm telling you that you do it.
yeah.
You actually do it very well
Okay,
also.
okay. Thanks, man.
Yeah.
And then from there, you had a couple of stingers,
Mm-hmm.
if you recall. So some neck and shoulder issues during the break. I think you started getting more into contact training, contact drills, and even games. Yeah. Then again in October 2022, someone fell on your left lower leg,
Oh.
and then you sprained your ankle again.
Yeah.
Left side again.
Is that
right?
a
This is a
ATFL?
this is the surgical side.
Yeah.
Yeah, and you have pain at the back of your heel at that point in time. Yeah.
I think it came to a point that there's so much recurring injury that it just became a mess. It's like I don't even know what is what
left
already.
and right.
Yeah. Or even so, it's like I was just a pot of injuries that when I go and see my physio, it'll be, which one again? Can tell me, is it left or right?
Yeah.
And then is it relating to the previous one? But I realized that question was very important. Is it relating to the previous injury? And more often than not, it is a no, which means when I saw my physio for an issue, I recovered from it, and then a new issue came up. And one thing I had to learn and understand also is that the ankle is a very complex body part. Like, on paper it says I sprained again, but honestly I sprained it's a completely different injury. And I think having that knowledge helped me understand better that at least I'm not coming back to the same recurring injury. At least my healthcare provider is doing his job in fixing whatever issues I have. Instead of like, it's like saying, hey, my water bottle not filled. I come back to you and say, okay, bro, go and refill again. But imagine I come back to you 10 times and you're just telling me the same thing to refill a water bottle. Maybe I'm a bad refiller altogether. But if right now I'm giving a different issue, now I feel full already, but the handle cannot withstand the weight. At least it's a new problem.
Yeah.
And
nowadays you can't drink your water, but it's because of different reasons.
Yeah.
Okay.
I think that's the saving grace lah. Yeah, now that you mentioned that, it was when I knew that I am recovering. Actually, yes, but it's just new injuries that I'm getting caught up with. It's not old injuries. It's not re-spraining something.
Even though it's the same joint, the same body part.
Yeah.
But then now you have a deeper appreciation of like the number of bones you have in the ankle that you can possibly injure, the number of ligaments you have. Yeah, even sprains, there are like 3 ligaments on the side, on the outside. Yeah, you can do each one at different levels at different times.
Yeah, and I think, I'm learning the anatomy of the ankle. So it's like, you can have your tip paws from your calves all the way until the bottom of your foot.
Yeah, we just went through it recently. Yes,
just yesterday, brother. like I think I always had an injury at the top in the calves, and then suddenly became just where the ankle bone is, and now new one under the foot. So I think that's where I had more appreciation of the complexity, and I think that is also like my saving grace. It's like I know that I'm maybe injuring the same thing, but at least different parts.
Yeah.
I don't know how I make it sound like a good thing. But it is.
No, but yeah, I think it's true and important, because even when people come back for the same body part, right? Like it's hard to comprehend. So because they, especially athletes, see a lot of athletes, right? So they get very mentally strained. They think, after all the rehab, after all the work that I've done, after all the training that I've did, but I re-injured it. But then of course through the assessment, if I can tell them that this tendon is actually adjacent to the last tendon that you strained, actually it's a different issue altogether, right? Yeah, even though it's the same area, which often gives them a bit more clarity and also confidence in what they've done, because they feel like maybe, especially athletes, you guys can take it upon yourself a lot to say that I didn't do well enough. They get bogged down by it. Yeah. But just having the understanding that sometimes life doesn't go the way, and you did your best.
Yeah. it took a lot of discipline to do rehab altogether.
Mm.
And it's I think now I can only say that in retrospect, because at that point in time, I honestly thought it's the same injury.
Yes.
And I think it came to the point where I lost hope. Honestly lost hope. I was like, again. You say my outside ankle? I think maybe I was uninformed right, that there's got a complex body part. But I just said, outside ankle again. I don't do my rehab lor. Yeah, I kind of like, it came to a point, I think it was really low in my mental resilience at that point in time, but it's like, I don't want to do anymore. It's so tiring. It's so exhausting to even go to the gym and do something that is very humbling, right? Tiptoe until I sweat, sweat bullets, right? I think one thing that was very helpful was, I think, just patience from healthcare providers. I'm not sure if you recall this, but I did say, Bala, can I just book a session with you, because I'm not religious and doing my rehab at all. But I just need someone to watch me do it. And I think if that's what it needs to be done for you to get back on feet, please do it, man. I think painful lesson for myself, but I think ever since then I learned to be a bit more religious in doing my rehab. It does take a bit of accountability as well. I drop my physio some messages sometimes.
Too many times.
Yeah, but it's usually a progress related video or even text. It's like, hey, the last time you when you introduced this rehab exercise to me, it was 3 kilos, but it's been less than a week and now I'm at like 4 or 5 kilos. I think that mini accountability helps me track my progress. And I think it's also affirmation to my provider that, hey, you know what, you're doing a good job. And if anything, it also gives me confidence that what you are saying is correct. You're not treating for a wrong injury.
Yeah.
And it's always acute and targeted. I think that only shows how precise the diagnosis is.
Correct, yeah. So yeah, if you get the correct diagnosis, then the treatment plan shouldn't be complicated. Even pre-AI, these days, once you have the diagnosis, you can ask AI to give you the treatment plan, because that's the easy part. But if you chase the wrong rabbit under through the wrong hole, then you're not going to come out on the other side, right? So I think the diagnosis is very important. And one of the biggest thing that often in at least the physiotherapy industry, in terms of research, right, we always trying to tackle compliance issue. Yeah, because physios, we are good at prescribing, but how do I hold you? Because you're only going to get better if you do the things that I said. Even though I told you all the right things, if you don't do it, is that a good reflection of my treatment plan? So the physio industry is always trying to solve for that. So they have all these ways to track compliance and stuff, but you don't have to be too sophisticated. Just build a rapport and relationship with your patients. Check in, drop them a reel, drop them a message.
That's true.
Right.
It's important.
Of course, the higher level ones, they will update you themselves whether they are doing the exercises, and if they are, then it should work, right? Yeah, if you're on the right track.
Yeah.
Nice, man.
So there's ankle, shoulder. Whoa.
How about your thumb? Let's talk about your thumb.
Oh, that's freaky. It was first metacarpal fracture, is it?
Yes.
Crack fracture.
Thumb, metacarpal base fracture.
Okay, that was, so unlike the bigger injuries like shoulder and ankle, this was the most annoying one. The mechanics of the injury is, I believe I tackled someone. So it's rugby, right? So you kind of grab jerseys and all. So I think what happened is I grabbed the jersey, moving at high speed, landed. I think my thumb was probably just caught in it as well. Landed on impact, then it broke at the bottom of the base of my thumb. Why I say it's the most annoying one is that's where I really understood how important it is to have a thumb. I couldn't do anything.
Yeah.
And it was very humbling, because it was really those exercises where you're like, okay, now you just touch your middle finger, touch your pinky, slowly do that.
Those, yes.
And then I think where I felt very useless was when I was in a splint. I think you gave me a referral for a hand specialist,
yes.
Dr. Tan. I can't recall which clinic, but it's the Dr. Tan. She was very nice, by the way. Super experienced.
Dr. Tan Hui Ling. She's very good. Hence.
Yeah, like I think I've never had someone tell me that. So I had fracture history. I knew it would take time. But I think what was comforting was to say, I see this a lot of times. Like, you are not new. So that gave me a sense of peace, like, okay, you are experienced enough to know that it's not as severe as I think it is. And I think where she also gave me like the expected time to be down it was like, okay, you got 2 weeks to not even do anything about it. You can't even bear weight.
Mm.
Although you feel like you're strong enough, don't.
Yeah.
So I think that was very humbling because I had to do, even though I'm right-handed, right, that's why I realized I need my left hand to do some tasks as well. But it was crazy. That put me out for, I think, close to a month lah. I think 2.5 weeks for the fracture to heal, and then maybe even close to a month. So why I say 4 weeks was because I think I got a basic strength soon after that. But to be ready to actually grip stuff, that took probably a month after, so maybe 2 months.
But which is already not bad. I mean, just looking at my notes here, right? So that was January 2024, but by June, you were already in training, ramping up, and already saw me for a new injury, right?
I did get my life back. I did. Oh, tiring. I got my life back, then you give me away again.
And it was your right ankle gave you a bit of issues, and then your left inner knee as well. But I think you recovered from that quite fast.
Yeah, I think because knee. I think I want to touch on knee if you don't mind me sharing, because I think I have a lot of teammates that has knee injuries, and their knee injuries either go untreated, like they say, I take Acoxia, or industrial drug, everybody knows it one, right? Or some kind of painkiller, anti-inflams, right, for it. And then some go untreated, some say like, I'll just live with it because maybe old age. I think for me was same thing. You feel a symptom, go get it checked, rule it out. So I think I saw you for it, and that's where the treatment plan was very, very straightforward. I think inside the knee, I can't recall, but it was just like 2 rehab exercises and 1 exercise to do just before I do activity. And then I realized actually the injury not as bad as I thought lah. I scared myself more than I did lah.
Yeah. Correct. So I think again seeing or having access to healthcare professional to give you that assurance, so that often people think, oh, if I go and see a doctor or a physio, whoever, then I'm gonna get the bad news and I'm not gonna be able to play.
Yeah.
There's this like kind of weird thing that goes in your mind. Or if I go and find out, and if it's true, then I'll be out. So technically, if I don't go and see anyone,
ignorance
is bliss, right? But often it's not the case, lah, right? So you just get it checked, so you can go ahead with your task with a peace of mind. And like I said, like the treatment is the easy part. The most important thing is the diagnosis. If you get the diagnosis right, and if the patient is compliant with the advice that you give, it should be relatively smooth and quick recovery.
Wow.
Yeah. And then fast forward to 2025.
Oh, that's last year.
What do you remember from last year?
I think they were ankles and knee.
Yes.
But outer knee now or something like that.
Yes. So very good recollection of your injuries.
I think it's outer knee.
Yes.
Left
side. Yep.
I feel I had something in my back.
Yes.
Is it?
You had back pain.
But the most recurring theme was actually traps and neck for last year, if I recall correctly. Yeah. Let me check the answer now. Is it correct or not?
So ankles were an issue. Both. You had some other left middle finger.
Sprain.
The left neck. Had pain. I think we solved that mostly with dry needling.
Yeah. Okay. I think one is, if I just look back in last year, right, the different injuries actually exposed me to a different kind of treatment. I think a lot of my friends lah, right, non-athletes, they have the impression that physio is you go and do exercise. You see a doctor, they diagnose you, you go and see the physio to do the exercise with you, right? They think you're kind of like a PT.
Exercise specialist.
So then I realized that that's not very accurate. I think where I got very exposed to, and I think I said with you before, like, hey, what new toys can I play today? We have like shockwave therapy. We had dry needling. Then I got dry needling plus, which is you put the electrodes in as well to fire up some muscles that are probably sleeping. I had a big toe injury. A big toe injury where I can't recall what it was lah. But I think having the exposure of treatment solutions, right, actually gave me a lot more confidence knowing that when I see you for something, I can trust that you have the tools to fix me up.
Yeah.
Expertise is one thing. But to have expertise is like saying I have the strongest gun but no bullet, bro, then you're useless already. Right? But to know that you are the strongest gun and you have the bullets, the ammunition for it, that gave me peace of mind. I literally winning the war in my mind to know that, okay lah, sure, it seems small, but you come up, you give, what I like also is like you give me solutions. Like you want to do this, but it might give you a bit of downtime, or you want to do this instead. No downtime, but you ache a bit more. That option, actually, that active participation for me, actually helps me understand that I also have a responsibility in the kind of rehab that I want and I so desire. I think you a few times you also mentioned like the gold standard is this. The gold standard of recovery is you do this. And then me, I'll be like,
But
bro.
yeah, if you do this way, you cut some corners, then maybe the recovery is slightly extended. Is that okay with you?
Correct.
Does that give you better quality of life
Yeah,
this rehab juncture?
So I think that's very helpful also. So the theme of last year, something I learned, right? Knowing the different kind of solutions and having the choice gives me the autonomy, but also helps me understand that it is my responsibility for my rehab, for my recovery. So if it doesn't go well, I cannot blame my physio. I just chose this route. I choose to be lazy, then I get lazy results, so bad results. So I cannot blame my physio at all. But having that knowledge also, or like that awareness, help me understand that every time I go for a physio session, I must be intentional what kind of outcome I want. I started practicing that in voicing out my intention and what I desire for, or the outcome from today's session. Obviously, I'm not a professional, so please don't tell your professionals what to do. But I guess you can always just provide or share them your concerning points. So I think recently I've been saying like, okay, I want to get this fixed, but this is my timeline.
Yes.
Then is there, if you cannot treat, then what's my management plan? And then that's your expertise. I'm just a muse for you really.
Yeah. So I got two things to share on that, right? So one is I think we as consumers, laymen, we often, especially when it comes to medical issues, right? We feel like we know the medical professional. We say like, oh, got fever today. And then someone says, can you go and see the GP? Then it's like, what's he gonna do? You know, he's gonna give me a fever patch, give me Panadol, send me home, right? Then we don't go through that route. But actually, you know, you go and see a GP, for example, then you get diagnosed with something else that needs a different type of medication and then that actually solves your issues. Like I have been through that same route, right? Like I'm like constantly sick, constantly like flu symptoms and all that. But actually what I needed was maybe antibiotics rather than waiting it out.
So true.
Yeah, and so on. So I think that's the first one, to not assume that, because sometimes like a physio, we don't, first session I don't say like, oh, I got all of these tools.
Yeah, you don't show all your cards, bro.
Yeah, correct. I just show you what you need lah, right?
Yeah.
And sometimes they will take it back home and they will share with their friends and families with similar joint issue. Then it's like, oh, he did this for this thing. And they would, of course, allow them refer.
Yeah.
And then I don't use the same modality because actually it's a different issue altogether, lah, right? Then they're like, oh, actually, I thought I was coming here for this.
Correct.
Yeah, which is fair and fine. Yeah, just having that kind of a bit more trust and open-mindedness to before you see your healthcare professional is one of the takeaway from that. Yeah,
I think the cancer towards it, right, is in this day and age that we live in, right, information is everywhere. So you think that you are smarter than the professional. I think that is cancer already. I mean, that's creating this toxic cycle of like, I don't want to see because I can just find information, I just self-treat.
Yes.
But self-treating is damn scary, bro. I can have a cough, I Google, they say I got cancer. Like, whoa.
Yeah, you Google.
That is damn scary.
Correct.
Right, I coughed 3 days, now I got cancer, stage 2, no. I think that's where you have to learn to trust the healthcare professionals. And one thing I want to touch on, before you go on to the second point is, working closely with someone, the only reason why you have my data log was I see you enough small things, even like you said, right? If it's just a fever, I can always get a Panadol. If it's just a recurring thing, I can always just get the same Panadol. But one thing that when you see someone frequent enough, they have data, they can see trends. And then they will understand how to diagnose you better, or at least me.
Yeah.
Right. So my experience with you was when I share a new injury with Bala, he will actually go through maybe his data on me and like, oh yeah, this happened before. Do you feel the same symptoms? Or however he does that consultation lah. But that helps me understand that I'm not just coming for another Panadol. You understand a trend. You see he has the knowledge to understand the patterns of it. Like, is it a new injury or is it an old flare up instead.
Mm.
And I think that's helpful lah.
Yeah. Yeah, for sure. Yeah. So I was saying that. So the first point is that we tend to doubt or assume treatment that we may receive.
Yeah.
I forgot the second point.
No, I think your second point was because I was talking about themes of the last year, and then more my learning point was the solutions, the different type of treatment, and then the other was I think
No worries, but I think one key point is like you shared, because these days people tend to like say feel like maybe they know better.
Yeah.
Okay, I remember. So I remember the second point is to, like you say, coming into your healthcare professional and and letting them know why you're here, what you want out of this session.
Yeah.
So one of the key questions I often ask, like, what do you want to achieve today, lah? Like, how can I help you? And sometimes, of course, many of you guys send your friends and families over, and I always want to know what have they heard, what the other person has told you, to why you are here.
They might misinform.
Yeah, very often, that some will say, oh, I heard you do dry needling. Then, but I'm like, oh, okay, can. So now I have so you're here for dry needling.
Yes.
So that I can also try my best to see how we can work out the treatment plan.
Yeah.
To perhaps give you what you need. At the same time, so give you what you want, but at the same time give you what you need.
Yeah.
Right? Because it's very hard to break people's already perceived ideas of how a treatment plan should go. Right? So I don't want finish. There have been earlier days where I do my whole session. At the end of it, then they will tell me, oh, done already. Oh, actually, I was hoping that you give me a massage.
Oh, never say.
Correct. Yeah. Then you learn through your experience that you should ask it upfront. So, is there any reason you are seeing me versus someone else? Because many a times they will tell you, oh, I heard this, heard that, and so on. Say, okay, great. If it's something that's beyond me, like for example, oh, actually, I'm here for you to massage me for the next 45 minutes, right? I say, okay, then I'll upfront and say, sorry, I'm not your best guy.
Yeah.
No, it's okay. We can call it a day today.
Yeah.
Yeah, and so on. Yeah. So I think that openness and I often ask my clients to, before coming in, just come prepared, in a sense.
Yeah.
And I have husband, wives who come and see me. And then the husband would joke to the wife, say, hey, make sure you have your pain score numbers in hand before you go in, because Bala confirm will ask you.
Wow.
Then actually, okay, better think, it's a 4 out of 10. Okay.
Yeah. So that's interesting, man.
Yeah. So then, okay, let's move to 20, which is where we are at this year.
Yeah.
I think this, there are some recurring ones, which is your left shoulder getting better. You've been super diligent with your exercise. How's the program coming along?
The program is okay. Evidence-wise, it works. Emotions-wise, I'm like, why is it taking so long? Yeah, so it happened. Okay, I think this is probably the reason why I'm quite iffy about it also is because it feels like it might lead up to something major, like my broken ankle. Because having that trauma, then the chronic left or left and right ankle injuries, like there are some telltale signs to this injury right now. That's why I'm a bit concerned about it. And yeah, it usually starts with something not so traumatic. I just fall down. I felt limited range of motion. And that's what happened, right? I fell down in the game, came to see you, and then bam, I got like 3 different diagnoses. I heard labrum, don't understand what's that. I heard rotator cuff, and I heard ACJ.
Yes.
So these are the 3, right? I didn't really understand, but I know that the shoulder itself is a complex body part. I think at the point of time, I was very, very down because I was mid-season. I was trying to gear up for the national team again. And you always have to play your way in. There's no free lunch, right? And I think that was like a big hit for me, like, I'm trying to ramp up. I mean, I had some aspirations for this year. Now I'm down with this injury. But what was helpful, or where I actually saw the evidence of it progressing, was although I was diagnosed with initial diagnosis, right? Is that called a prognosis?
Working diagnosis.
Yes. It was the 3.
Yeah.
my main concern was I can't reach across my chest because I shower, then cannot. At one point in time, this shoulder never get touched, man. Like, cannot reach, bro. But I remember of the three, one thing that that you shared to how to treat it right was just do the rotator cuff first, external rotation. Right. So we worked on that. We worked on it for like 2 weeks, and then within 2 weeks there was great progress. And then remember coming back to how I said like the problems are not the same anymore every time I come back to you. So I think that's where after the 2 weeks mark, like I'll come back to Bala like, hey, it's actually getting stronger, but there's a new symptom now. And then you assess me again, like, okay, now we can rule this other injury out. And then I think we solved the rotator cuff, so external rotation, like going outwards. And then now we're on a new injury now. Now we focus on the internal rotation now. I think.
Yeah. So we did the strength test.
Yeah.
And then we found out it was quite weak.
Yeah.
Then we just need to zoom in and maybe fix that deficit. So that's why quantifying all this strength assessments are so important.
Yeah.
But yeah, I mean you've been diligent, like as with all your other injuries and years. It's already getting you through. You're already back to training and your game coming up.
Yeah. I guess what helped also was where one, you gave timeline, you gave a goal standard, and then you managed my expectations very well. It's like right now, I know your concern, I hear your pain points, because I think a few times I was asking like, should I go MRI? And then I think that's where you said like, hey, you know what, if you want to go for imaging, like that detailed imaging, you might want to consider surgery. I mean, usually you do that. I mean, there's like a pathway. And then when he said that, I realized like, but I want to play. So I don't want to go through surgery. So can I delay my MRI then if I need to do it? At least that was internal lah. It was processed within myself. And then I think what was very nice also was where as you made it very real that it is a work in progress. If you want to play the upcoming competition, you can manage it now. Like you will feel pain, but we manage it. Not like, or just try play that's your luck, if you break, you break. But it's like, let's do everything we can to protect it, at the same time trying to rehab it. And I think that finding that sweet spot was comforting for me as a patient. Because naturally, right, I was like, hey, Bala, I got like dreams and aspiration, but now I'm down. I think I've seen other providers as well, healthcare providers. And I think one thing that they don't do that you do very well is they err on the side of safety. Like they don't want to take responsibility, right? So they say, then don't participate in the competition. Don't err on the side of safety. Let's not do it. Then you rehab properly first. It's like do one, then the other. For lack of a better word, it sounds like a lazy way of saying, I don't want to be responsible for your injury and if you don't get better. And I think what gets at me is when I've known people around me that see these providers and they say, hey, they're the best. And then my question is, what is best? Is doing the best taking you out of your goals that you had? Or are you just not a high performer, let's say, that you are okay just having a longer downtime? So I didn't understand why they say, oh, this is the best. This guy is the best. Because I went and like, but he told me different thing. He wanted me out of my sport. He wanted me to not do anything about it. Or like do my rehab only and not participate. Yeah, so I think management plan is there's something new, and it really is important to me.
Yeah. So I think it comes back to compliance, right? So end of the day, dishing out advice is not too difficult. So I can easily say just if it hurts, but when you do this, how about you don't do that, right? That's quite an easy solution. And having treated all these athletes, right, you know for a fact that they're not going to listen to you. So what's the point of even dishing out the advice when it's going in 1 year out, and you're probably putting them at higher risk because now either they're going to hop providers for them to maybe hear something that they want to hear.
Seek validation.
Correct.
That's so sad.
So rather than work with them to treat them like adults, in a sense whereby you let them know the pros and cons, the risk that you are going to be putting on yourself, because they can manage their own risk, right? You just tell them, chances of the ideal gold standard recovery time frame, let's say for such an injury, on my experience, is this long. So if you want to continue doing these things in between, it may drag, you may get injured, you may have more pain. If that's something that you're open to, okay with, we can do certain things to manage, like taping, painkillers, so on and so forth, right? Doing a rehab, activation drills,
Yeah.
and then or seeing me right after your game, going through some form of recovery plan right after your games. Those are ways to prolong your exposure
Yeah.
with minimizing the risk. Right?
Yeah.
So
I don't know if we have any more things, but I think if I look through it all, I think I did mention a few things that I've learned as an athlete and even working with a healthcare provider. I think I'll start with the don'ts first. There are some things that I've learned. I think one is don't think that you're too smart, like as a patient. Cause that limits your how to say it brings your walls up that you don't want to find a treatment plan even. Then because you think that you can self-treat, right? And then I think another is don't assume it's too small to be unnoticed. Because all these small injuries actually it's compounding effect, bro. It's like I think we mentioned a sprain in my finger. I think it went by. I thought I recovered. But honestly right now, there is a limited strength in my middle finger. So like really just don't overlook these small injuries. Like please get it checked. And then the last is for don'ts, at least I think these 3 points that I can think of is don't doubt your provider's advice or their treatment plan. I mean it comes back to like don't think that you're too smart because once you have that doubt, once that seed of doubt grows, the level of trust is broken, that level of confidence even breaks. And then that's where it really tears relationship with your provider. Like suddenly you're not replying him and things like that. And I think that's very that doesn't help you in your recovery period. The do's are definitely quick response. Do your rehab, that's 2. And the last is I guess is just do refer people properly. So like you said, right? Like, oh, I did dry needling. Then I tell my auntie, hey auntie, I do dry needling. Shiok. And then auntie come to you, hi Mr. Bala, I want to do dry needling. But that's not the issue. So do refer your healthcare providers appropriately also. Because if you tell them the outcome, but you never tell them why you saw them for, then people will have misinformation. Right? One thing that an example would be, I think when people always introduce me like, oh, this guy is Singapore Rugger, but like, why do you tell me I'm funny? Like, what is so great about me that you enjoy being a friend with me, right? So
shall let with that.
right. So instead of like introducing by profession or what was done, I think introduced by experience. I think that helps the healthcare provider even know how to treat. I mean in my profession, in my day-to-day job also, I get referrals and I receive those texts and can I ask what was said of me? So I kind of know what to know. And then some of them actually say, oh, they say you're the best. Then like, so define your best now then. What is the gold standard and whose standard are we looking at? So the 3 don'ts and the 3 do's, and I think it's something that I hold it very importantly to me. That I hope that people will actually understand how important this industry is, the healthcare industry is, how injury management is actually done, and not these ideas or misconceptions that they have. And they know how to treat each other with respect and even respect yourself more so that you know how to seek treatment. Yeah.
For sure, man. Right. Thank you so much for sharing your story, your experience, and your words of wisdom. Yeah, appreciate it. And thank you for being such a loyal and passionate client of mine.
Oh, I wanna that's very good, right? Sorry. But loyalty was actually just the byproduct of the excellence that you showed.
Oh, wow.
Bro.
Quote him.
No, but really, I think it was never like you're the best. But because of the excellence in your service, I have no choice but to be loyal. Yeah.
Thank you, man. All right, that's it for today. Have a good one, bro.
Let's act like as if I never just saw you yesterday.